The question is, what should I do if I poke my wisdom tooth socket and it started bleeding? I am on day 6 after wisdom tooth removal. I used a toothpick and only a bit of blood was on it. I began rinsing with a syringe after and it was oozing blood. A lot of times it is not uncommon for you to see some kind of a oozing of blood even days after the procedure, or even sometimes we have patients on blood thinners and they see blood oozing from the socket even weeks after. It's just not uncommon. As long as it is not a profuse bleeding, what that means is, the bleeding you cannot control, or it keeps oozing and you're changing the gauze piece over and over and you're not able to control, that may be a cause for concern. A lot of times, just like you mentioned, if it is just a simple oozing of blood, a lot of times you're able to put some pressure. For example, if you had a cut in your finger, you're going to put some pressure right on the top of the cut to hold it, and the bleeding will stop, right? So the same thing, if you have bleeding from the back of your mouth where you had the wisdom teeth removed, and you take a bit of gauze that was given by your practitioner, or if you don't have one, you can buy them very easily from the drugstore. You take either a 2x2, a 2 inches by 2 inches, or a 4x4, 4 inches by 4 inches gauze piece. Fold them in half again. I tell my patients to make it just like a golf ball, and you put it in the back of the mouth and you just bite down on it for about 20 to 30 minutes and the bleeding should stop. And if you're concerned, if you're still bleeding before you go to bed, put the gauze pieces in the mouth. If it is a 4x4, you can even leave them in the back of your mouth. Go to bed in a recliner and make sure that you're not going to choke on them, and you can go to bed in a recliner. And if you're concerned about the choking, if you don't have the 4x4 gauze pieces, you can even take 2 tea bags with the strings on them. You can put them in the back and you can just bite down, and the tea bags will help you put some pressure just like the gauze pieces. And also the tea bags, what we call as a tannic acid in them, that also helps with the blood clotting, and that should help you with stopping the bleeding. Long story short, again, if you have a little bit of oozing from the wisdom tooth socket, not to be concerned. You don't have to be concerned. Just put some pressure with either with some gauze pieces or using the tea bags, and that should take care of itself. And if you happen to have continuous bleeding, I recommend you seek immediate care with your dentist or the surgeon who removed the tooth.